I know we've got a short amount of time and I've got a lot I want to share with you. So please think about questions that you have for the end, and I'm happy to answer anything that I can. Just to let you know, for over a dozen years, Canada Life has supported, funded, and been there for all employers, no matter whether they're clients or not, across the country. Everything on workplace strategies for mentalhealth.com is available for free in English and French. So I'm telling you this up front so that when you're listening, you're not thinking, well, is this something I have to purchase? It's all free. So let's get going. I also want to share with you that all of the resources are evidence or practice-based, meaning that we work with people like you, people that are running businesses, people that are on the front lines, as well as with experts, researchers, academics, to make sure that what we offer is both practical, meaning that you can actually use it yourself, and that it will work, that it has the evidence, the practice behind it. So just to help you with that, this is what our homepage of our website looks like. It's split up between psychological health and safety, which is organizational approaches to policy, to prevention, and then managing workplace issues, which comes down to you as a leader interacting with one employee who may be struggling or with a whole team in order to improve the dynamics and improve how the team operates. In employee resources, we have a lot of things for you as an individual, for you as a family member or a caregiver, and for you at work, coping at work. So all of that's there. And I just wanted to make sure that you understand that it's there all of the time and it's always free. So you were kind enough to write in to the chamber about things that you wanted us to talk about today. And I grouped them into these four main categories. You wanted to know, how do I deal with people and what are they feeling and how should I think about or respond to that? And I have been a small business owner for over 2 decades, and I can tell you that the pressure to support my employees, to keep them well, to keep them healthy, to know that I'm the source of income for them was always overwhelming. I can't even imagine what that feels like now when you add this extra pressure to you. We talk about tips for coping. And again, you know, the title, When Stressors Collide, we as business owners have to cope all the time with the thought that, well, I'm doing okay right now, but what about next month? And what if this fails? And why do people think that I have all the answers when I really don't? So we're going to talk about tips for coping, and we're going to talk about ways to build resilience. So your own, but also to help support the building of resilience of the people around you. And then we're going to talk about reaching out for help, where that is, what you can do. So thank you for providing me with that framework. When we talk about what people might be feeling right now, the thing is that we're feeling all the feels. There's people who are going to be afraid. There's people who are going to feel like this is a vacation, that it's the best time of their lives. I was talking to a friend who has clinical depression, and he said to me that his anxiety level right now is lower than it's been in so long, because he's not having to deal with work and dealing with all of the interactions and all of the pressures. He's just at home caring for a loved one, and that really his life seems easier right now. So first, we don't want to assume. But I love this framework and wanted to share it with you. So many of you will recognize the name Kubler-Ross. Elizabeth Kubler-Ross wrote about the stages of grief, but many people have taken what she has written and translated it into the stages of change. Now, the one thing I want to tell you before you even start is that these are different places we can be, but we jump around, and we will, and I have, and I'll tell you a little bit more about that. So they say often whatever that event is, whether it's a tragedy, it's a loss, it's a pandemic, first we're kind of like, what? What's happening? What are we talking about? We're kind of surprised. We're kind of not really sure. And many of us in early March were at that stage where we're thinking, well, what's going on? And then when they put us all on lockdown, we're like, okay, now what is this? Some people went into denial, saying, oh, it's just like the flu. You'll be fine. It's not a big deal. Don't worry about it. And started to look for conspiracy theories that this maybe was just put upon us and that it's nobody's really sick. They're just pretending and they're getting slides from other countries, whatever, went into denial. Then many of us might get to the place of frustration where we're saying, you know, this has gone on long enough and I want to get back to life as normal. Or I don't want to have to stay inside anymore. And why can't I go out? Maybe we're angry, but we start to get agitated by the way things are. And a couple of things can happen there. We can actually burn ourselves out in a way where we feel down, we feel hopeless, we feel trapped. Our mood is not great and we don't have a lot of energy. When we're there, it's really important to understand that the longer you're there, the more likely you are to have other health problems. So it's okay to be there. And I know I was going along thinking I was doing all right. And then right after the Nova Scotia tragedy, I really had one of those bottomed out days. It just was too much loss, too much sadness, too much powerlessness. And I really felt hopeless that day. But because I understand this stuff so well, I went next to the experiment stage, which is, I said, okay, what am I feeling? Why am I feeling it? And what can I do differently to pull myself out? And this experiment stage is where you want to spend the most of your time, if you can, thinking about, if I feel sad, what could change that? How can I shift my thinking? If I feel exhausted, how can I manage my sleep different? If I feel alone, who can I reach out to? This is a really important stage and a really important thing for you to do. Take back control and responsibility for your own mood, for your own emotions, and start looking at what you can do. And then we get to the decision phase, which is where we start to think about our own new normal. What do we want to do differently now? We found things like, I'm not going to watch the news all day. I know that's not working for me. I'm going to make the decision to check in a couple of times a day because I need to know, but I am not going to listen to the people that are blowing this out of proportion in terms of sensationalizing the news. I want to know the facts. I want to know the science. So we make decisions about how we're going to manage. Another thing that I've done for a long time is I curate my social media. And what I mean by that is I make the decision that anybody who's on my social media that spews negativity, anger, hatred, they're gone. I don't think twice about it. My social media are all what my friend Maureen McKenna calls like-hearted people. Doesn't mean we agree at all. People with lots of different opinions, and I love that, people who are provocative, but that they all want to serve the greater good in some way. So curate your social media, have what you want on it, and get rid of the rest. And then the last stage here is about integration. And that's when really we start to integrate the new for us, the new normal, how we want to show up in the world, what we want to do. We integrate it into our lives. And I've said several times that right now, this very moment, you are writing history in terms of the decisions that you're making day by day. In 10 years, in 20 years, you're still going to be talking about the COVID crisis, what you did, who you reached out to, who reached out to you, how you stayed connected, how you dealt with those down days and still continued, how you persevered. Think about that. And as you're writing that story, moment by moment, try to be the hero of your own story. What that actually does is it puts you in the present moment. And that's really all that mindfulness is about. It's not about sitting on a cushion for hours on end. It really is about being in the moment and choosing in the moment. So you asked for tips on coping, and we've been doing a series of videos, really short because when I was young, they used to say we had Sesame Street attention span, but now we have Twitter attention span. And so the videos are 1 to 2 minutes, really short. But we cover things like dealing with distractions at home, dealing with guilt if your coworkers have been let go, but you still have a job, dealing with fear of the unknown. Lots of little easy things that you can watch on the YouTube channel for Workplace Strategies for Mental Health, and then share them with the people around you if you think that they would resonate with them. We've got resources like our healthy break activities. And of course, we wrote these thinking about people taking a break at work, but they translate quite well to the home. And there's 3 categories of break activities. One is to energize you. If you're feeling exhausted, what is there that can energize you and keep you going? There's the idea of things that relax your body. Maybe you're really tense and you need to do things to relax, or maybe it's to calm your mind because it's racing right now. But these activities we gathered from health and wellness professionals from across the country, and they take 15 minutes or less. So you can start looking at that to share with the people around you. If you have an employee who has a much more complex problem, and it's really interesting to me because a lot of the work that we do is, what if you have an employee who has depression or post-traumatic stress disorder or bipolar? How do you support them? And this resource, Supporting Employee Success, is a very comprehensive tool to help you work through the issues, like exposure to stressful situations, like working relationships, like meeting deadlines, the kind of things that really happen when we're stressed out. And yet this can be useful right now. It's too big a resource for me to share with you completely right now, but have a look at it. And the other thing I want to say is, if you look at anything and you're going, I'm not sure, how can I do this? What can I do? Just use the Contact Us on the Workplace Strategies site and we'll respond. We'll help you out to figure it out. There's lots of subscriptions. Here we have a mental health awareness subscription. So what you get each week is either a short clip, less than 5 minutes, or you get some information. And these ideas are there to build awareness about our own mental health, about people who may be struggling, and you can share them with your staff by forwarding them by email. Those activities I talked to you about, they're all available through subscription. You can sign up for our newsletter, which means that when we add new things, you're going to be the first to know about it. And this last one, it should be live in about 2 weeks, but it's about you as a leader. And at each week, you would get a tip about something you can do to be a psychologically safer leader. So lots of things there. You asked about building resilience. And this book, which again is available free for download, it has 2 parts to it. One is about building your own effectiveness, your own resilience as a leader, about how you interact with staff and how you manage your own mental health, your own wellness. The second part, though, is something that you could use right now with your team, because the conversations that build resilience, and you can do them online as easily as you could face-to-face. And there's dozens of ideas. You can look through it, pick what resonates with you, and use it to connect online in a way that builds teams and builds the team's resilience. We also have this one here, Planning for Resilience. Plan for Resilience is to help you to become more resilient. And for anybody who's self-employed, there's a section in there about really dealing with the stressors that come with being self-employed. There's a version for post-secondary students as well, because we realize that that's an important time. So you can share that with anybody in your life that has it. But let me tell you a little bit about Plan for Resilience. We help you identify what your stressors are. We help you to identify your automatic responses to stress, those things that happen before you have a chance to do anything about it. And then we help you come up with a plan to deal with stress more effectively. And it really is quite effective in putting things in perspective for you. There's something in there called the 4 A's, and I really encourage you to check it out. It's a great way for us to stop spinning about being stuck or trapped with a stressor and move forward in a way that's healthier for us. We also look through resources that are available online, and anybody who's ever been there knows there's millions of things online, but we make sure they're credible, we make sure they're evidence-based, and we make sure that they're useful to you. So you can go on and look at resources that might help. This one here, the VIA survey, is where you get all of your team or just yourself to go on, take the survey, it's free, identify what your personal and natural character strengths are. So not what you value, but what comes easily to you. And then once you know what that is, you can use those strengths in times of stress. And you asked about reaching out for help. And I have to say that the first thing that's most important is to understand that you cannot be resilient unless you know how, and you will reach out for help. I have always felt like I was a fairly strong person, but I burned out. I crashed. And it was because I thought I never wanted to burden anybody else, that I should be able to do it myself, that I should be independent. But I did that to the detriment of my own well-being. It was somebody who said to me, "Why don't you ever ask anybody for help?" And I said, "Because I don't want to be a burden." And they said to me, "So you think all the people you help are a burden?" And I said, "No, I don't think that at all." They said, "Well, you must, if you think you would be." They said, "How do you feel when people reach out to you?" I said, "Well, I feel honored that they trust me, first of all, to reach out to me. And I feel like I'm of value. I feel like I have purpose. I'm glad to help." And then they said something that has really stuck with me. They said, "Why would you deny, especially the people closest to you, the opportunity to feel that they are of value to you, that they are trusted by you? Why do you keep everybody at arm's length?" And it was like a virtual slap in the face, because I realized that's exactly what I was doing. I didn't feel that I was doing it for that reason. I honestly thought I was saving people from having to deal with any of my stress. But I realized that I was keeping people at arm's length, that they want to help, that it increases the connection that you have with people. Today, I will reach out simply because I want to improve my relationships and my connection with people, even if I know I could do it myself. And when you learn to do that, you will find that the quality of your life, the quality of your relationships will improve. But maybe you need something else. And there's screening tools on the ementalhealth.ca site, so that if you think, well, am I just stressed out like everybody else? Or is my stress beyond that? Do I really need some extra help? You can check it out there on the eMental Health app. We have a crisis line now in Canada, Crisis Services Canada, where wherever you are, you can reach out to them and they will link you to a crisis line that's closer. And you can also use the kids helpline. and they have both text and phone, but it's not just for kids. They will also help people to get what they need. So if you think you need something more, it's there. And so much right now is free. If you actually Google Free Mental Health Canada, you're going to see a lot of resources because people are stepping up. People are saying, we had this tool that was online and we charge for it, but we want it to be free right now, all over the country. Individuals, so individual psychologists and therapists, plus big organizations like Morneau, Chappelle, and Canada Life, they're really bringing things out there to serve the greater good. So there's lots of help available. This is the web address that I was telling you about, workplacestrategiesformentalhealth.com. And I just want to remind you again that everything that we have is free. There's no, you don't even sign into our website to get these things. You download them, you use them as you wish, and they're all available there for you. So Leah, I know we want to get to questions, and I'd love to be able to answer some now.
Wonderful. And foremost, I'm a little bit lost for words here, but I just can't thank you enough. I'm sure we're going to make this PowerPoint available not only on our website, but maybe we'll loop back to those on the line directly with this, because I think those resources as you run through them are very important. But for us to be able to access them in a meaningful way is great. And I actually want to thank you as well for sharing that personal story too, because I think that helps. You know, it's the idea that we're all busy helping everybody else, but that we also have to help ourselves. I'm going to turn my attention here now to the Slido. So folks, for those who are wanting to ask a question, please jump on there. And our first question here, Marianne, is how can we support colleagues who are feeling alone? When do we need to really, really worry about them, and what do we do? And then after dealing with this, how do we ensure self-care as well?
Yeah. And you know, the idea is that right now it's critical that our interactions with people are not just about work, that we really start off saying, you know, how are you coping? What are you finding is working for you? What is a challenge for you? A lot of what you're going to see on Workplace Strategies comes down to, if we can ask the right questions, we are better leaders than if we can make the grandiose statements. And so when we're talking about employees who may be struggling, that's what we want to do. We want to say, tell us how you're coping. So we start with a positive. How are you coping? Assuming that they're doing some things to keep going, and that if you have more than one people, that they can share that. But the other question that is always helpful is, and what else? And what else? Because often they'll say, oh, you know, I'm just doing this or that, and you don't really get at the deeper issues. So if you really want to know, keep asking them what else until they say, that's it, that's all, there's nothing else. At that point, then you can move on.
Thank you. The next question here, I mean, you've given examples of a plethora of resources that are free of charge. But the next question is, what about financial support for those needing counseling? Any advice or insight? Oh, hold on. She's on mute. I can't. Thank you. Go ahead.
So right now, I think I still might be muted. Let me just have a look.
No, I can hear.
Good? Okay. So right now, there is so much that is available that is free. And like I say, go back on and Google Free Mental Health Services Canada, and you're going to find so much. When there is no money, then the idea is you have to go to your family physician and get a referral. And it can take a lot of time. In the meantime, talking to friends, talking to family members, journaling, going online to the resources that are there. You know, there's so much that's available that you just need to look, but you don't have to go to the website. Just go to our employee resources and you're going to find it. Other
So,
questions, Leah?
yeah. Me? Great.
Yeah.
Next question is, how can we ensure that our messaging is inclusive to all employee groups and communities?
Again, it depends on the context, right? So you can't be inclusive when you're making statements, but you're always inclusive when you ask questions. Because then you're inviting people to speak their truth, to talk from their perspective. So the best way to do it is, you know, to ask that question: how are you coping? What do you need from us? How can we serve you better? You know, here are the things that we offer in our business. Is this useful to you? Is there a better way that you can get it? I've been amazed at the innovation. So a woman who runs a cosmetic sales company has gone on and said, if you call in and you say, I need that new eyeliner, I will know that you're in a domestic abuse situation. And if you say this, I will know that you want me to call the police. So people are finding ways. We have this lovely little tea room in the area where I live. And of course, they can't be open. But what they're doing is they're using their supply chain to give us access to fresh produce and groceries that they deliver to us. And they started off one way, then they started to hear what people were doing. They gathered together with other businesses in our small town. So to be inclusive is to ask, how can we serve? How can we better meet your needs?
Thank you. Next question is, how do we keep motivated? These are multi-layered questions. How do we keep motivated? How do we motivate staff? And how do we instill work-life balance?
So on that day when I was not motivated at all, I gave myself a break, first of all. You know, I stepped back. I said, I'm not going to push through today, because that's when I burned out. That's was always my mindset. Push through, you know, you can do this. And I won't do that anymore. If I feel like I'm pushing too hard, I will step back. So that's one way to motivate yourself, is decide that you are worthwhile to keep well, and to do that first. Then you look at, as Simon Sinek would say, look at your why. Why are you doing it? Is everything you're doing really that important? Or are there certain things that can slide for a bit? And can you focus on what you think has the most importance and do that well, rather than trying to do everything and feeling like you're a failure at it all? You talk about motivating employees. And again, if we can make our employees understand how they're serving the greater good by continuing to work, to make sure I get to talk to wonderful people like you, I get to be out in the public and hear the difference that we make. But the people that sit in an office and help create the resources, they don't get to hear that. It's my responsibility to bring it back to them and say, look at this, because of your creativity, because of your design, because you made this for these individuals, this was the impact it had. So that's how you motivate. And if you can make that directly linked to the work, that's great. And if not, then maybe motivate your employees to do something as a group to serve the greater good right now, to feel that they have purpose. Was there a third part to that question, Leah?
Yeah, it was the question about work-life balance, Marianne.
So here's the thing, is I don't believe there is work-life balance, especially for people who run their own business. I believe that what we really have to strive for is balance in the moment, because sometimes work is going to take priority, that we have to do it for survival. We have to do it to pay the bills, whatever. And sometimes family's going to take priority. So there's not balance there in the moment. We have to decide that being resilient is the investment we make in ourselves. And to understand, as the late, great Stephen Covey said, you need to feed the golden goose, and you're it. If you're a business owner, you are it. And if you don't take care of you, you are depreciating your most important asset. So yeah, that's what it comes down to. But I had to hit a wall before I believed that. Don't do it. Trust me. You don't need to. Take my word for it.
Thank you. I really appreciate that comment about balance in the moment. I'm going to continue to read the questions, and then we'll go to the raised hands. This next question says, kids at home, from home, childcare perspective, but from a mental health.
So Leah, I only got part of that question. But
oh, I'm sorry.
It's about
it's
at home.
And it's from the mental health perspective, not the childcare perspective.
Right. So here's the thing. Children will breathe in our secondhand stress. Therefore, it's even more incumbent upon us to find a way to keep ourselves well. But the tip that parents have been most gravitating towards in the different talks that I've had is this. Children do not understand that they're not the center of your universe. They believe that wholeheartedly. And if you're home, then they believe that you're there to be of service to them. And what I found when my children were young is that if I said, just give me 5 minutes, just wait, I just need to finish this, that they would just keep coming at me. And I would get more and more stressed and more frustrated with them. It didn't serve anybody. What I found is that when I stopped what I was doing and gave my children 100% of my attention, looked them right in the eye and said, tell me what you need to tell me. I'm listening. And I really listened intently to whatever it was, that they couldn't sustain it. They got bored with me and they'd be gone. So rather than fighting this, for a long time, trying to just get them to stay, if I actually paid attention to them, it would work. But then I had one child who thought that he would wear me down by arguing about why he should do something that was really not reasonable or practical. And Barbara Coloroso, in her book, Kids Are Worth It, actually shared this. What I would say to him is, if you stop talking now, I'll think about it and get back to you in an hour. If you keep talking, the answer is no. And it worked like a charm. So there's no easy answers to maintaining your sanity while you're trying to work at home and you have young children. And there was a professor at the Smith School of Business who said, if you have small children and you're working from home, you should expect 40% of your productivity. 40%, less than half. So if you understand that, if you accept that that's the case, then you stop trying to think that you're going to do 100% of your work. You've got to accept what is right now.
Thank you. Question is, in our association, it seems to be the younger demographic that is struggling. Anyone else experiencing this? You addressing it?
So I think the main thing for almost everyone is to have the right amount of social connection. And how that is done is different for people. We're connecting right now through this medium. I know some people who are playing video games probably 10, 12 hours a day, and they're quite happy. They feel okay. Um, I think what we need to do is find a way to allow them to do what they miss in a different manner. Some people are talking outside, they sit on their step, and other people come pull up a chair on the lawn. They're socially distant, but they're talking. So it's about being creative, not just saying you have to stay in your room and that's all there is to it. But the other thing for young people is they may think that this is the way life is going to be for the rest of their life, right? Because they don't have the perspective of the ups and downs. And so showing them the things that happened before that people got over and how they went on to have a life after that can be important. Also asking them to imagine a new normal for themselves. What do you envision when this is done, when we get to go back? What do you think will be different for you? How have you grown? There's this concept called post-traumatic growth. And we talk about post-traumatic stress, but not about this as much, which is more prevalent. It's where we go through a challenge, a difficult time, and we learn and we grow and we become better people and we do things differently afterwards. If you showed them Nelson Mandela's story, Viktor Frankl's story, Harriet Tubman's story, and said, look at what these people went through, but look at how they turned things around afterwards. We can do that. We can be the heroes of our own story. And I think for young people to start impressing upon them to write their story or type their story or record their story every day. How have you coped? What have you done? How have you helped people? Then you're giving them this sense of purpose every day that they'll be able to look back on for the rest of their lives.
Thank you. The next question here is that can you provide recommendations/resources specifically on time management?
So I don't believe in time management. I believe in energy management because I used to live my life in 15-minute increments. If I didn't get something done every 15 minutes, I felt like a failure. And I was always pushing for that. And as I've already shared, that brought me to burnout. And what I do now is energy management. When I have the energy, I prioritize what's important, what I know I have to do. And my times of highest energy are spent to the things that I prioritize. What is most important? Sometimes that's my family. Sometimes it's my health. Sometimes it's work. But whatever it is, I will prioritize it. I will get it done. And this stops me from thinking I need to do it all. Prioritization of work really helps you to focus in on doing something really well. The other thing is, as much as you can, to do one thing at a time, because we know from the research that you will be better focused, you will be more effective, you will be more productive. So time management to me is just adding more stress, but prioritization and managing my energy is way more effective.
And we do have a similar question to that puts a little bit of a layer on that. And I'm not sure it makes a difference, but I am going to ask nonetheless. It's this idea of time management or energy management. I do take your point now. But when you add the layer of this period of uncertainty, is there any more or comments you could add to that layer?
Right. So somebody said, in times where you feel out of control, control the heck out of whatever you can. And what that means is that we look at what is within our control. As a leader, I need to be positive, but more important than that is I need to be authentic. So if I just say, oh, don't worry, we're all going to be fine. You know what the leader at Canada Life did, though? He said, we guarantee you there will be no layoffs in 2020. So he calmed everybody down. It's like, oh, okay, we're not worried that tomorrow this is going to happen. But what nobody can say is what's going to happen long term. We don't know. But when you know that your employer has your back, is doing what they can to support you, to protect you, then that will reduce some of the stress. But if you say, just don't worry, be happy, think happy thoughts, that's not going to work. So you can bring people together to teams saying, okay, here's where we are. What do you think is the worst case scenario? What do you think is the best case scenario? What should we be doing now? I was talking to someone in another organization, and what they were saying is that everybody's going to be asked to work less hours now, because they went and they've continued online, but now everybody's going to be asked to work less hours. But they're letting people volunteer. You know what? I only want 2 days, or I only want a day, and I will find another way. And so really working together to say, we care, but there is a reality. I can't just keep paying people if there's no income, right?
And I say to folks here, we've got a couple more questions. So, and then I've got some hands up, so I will get that. So if people want to feed through here, please do. And Marianne, I take your comments, and that's great news from Canada Life. But next question, and I know you've addressed it a bit, but what if you are the employer, right? What about supports for small business owners and entrepreneurs themselves? I know you've spoken a little bit, or more than a little bit, about that and from your own experience, but is there anything else you can add?
Well, so as a small business owner, I would really encourage you, first of all, to take care of your own well-being, because all the decisions you make, all the problems you need to solve will be much easier if you're well, if you're rested, if you're mentally healthy. So that's the first thing, no matter what it is. But then to find out what is available. I remember years ago when the auto industry was kind of imploding, and somebody said to me, well, can you come and talk to these laid off auto workers? They're all going to be losing their jobs, and speak to them about their mental health. And I said, well, what about speaking to them about putting food on the table and paying the bills and getting a resume together and finding a job? And we were talking about that sometimes the things you need to do are very practical, rather than more motherhood statements or vague things, is to do the practical. And in that plan for resilience, it leads you through questions about, what if you can't work? What would you do? How would you do it? Are there other people that could take care of your clients? Are there people that could help you do this? Is there a way you can have passive income? This idea of passive income, of being able to earn money without you personally being present with someone, is exploding around the world right now, because it has to, right? We have to think about it. So get together with other people that are in your business, in your line of business, and try to problem solve together. What are you doing? How are you handling it? There's no simple answer here, but I think together we can brainstorm a lot of things.
Appreciate that comment. I keep taking down all of these nuggets, in the sense that, for small business, they're often, getting in your own space and trying to find out, others that you had even said are like-hearted as well. So another question that's come in, Marianne, is that it says, you've mentioned many resources are free. How do we know about quality?
So on workplace strategies for mental health, they're all evidence or practice-based. So we've already vetted it. But in terms of mental health resources, you have to do your due diligence. And you know what I say? I think that you should shop for a therapist. In other words, to say, first of all, identify what you want to be different in your life. Is it that you need to deal with a particular fear? Is it that you need to raise your mood up? Is it that you need to, whatever it is you want to deal with? make sure you're clear. And then when you call, say, I need help with this, what would be your approach? And if you don't like what they say, if it doesn't resonate or connect with you, then keep looking. We do that with all other services that we buy. So we don't need to just say, this is the first person who picked up the phone, therefore I'm stuck and I need to only deal with them. Or to think, this isn't working for me, so maybe it's me, right? This is Dr. David Burns from California. He said a lot of people think you need to be in therapy for years and years and years before it works. And he said it's not true. It works like this when you have a shift in your thinking and you then see and interact in the world differently. But it can take years and years before you find that thing that shifts your thinking. It doesn't mean you're cured, but you should feel improvement immediately. And if you're not, then stop doing the same thing over and over again, right? You got to try something else, because what works for me to pull myself up may not work for you. And the challenge, there's a resource on our website called Working Through It, where we interview people who have had a mental illness at work, off work, and then have returned to work. So they're speaking about their experiences, but they're doing it in a way to say, this is what worked for me. And then you get someone else saying, this is what worked for me. And the idea is we give you a buffet and you choose what's going to work for you. And that's the human condition, right? We're all going to have times where we're not coping well. That's normal. It's what we do in those times that will determine the quality of our life.
Great, thank you. I do have one more on Slido. It's more of a comment, I think, than a question, but I think, and you've said it already, Marianne, but obviously it's worth reiterating. Then I'm just going to flag, I am going to go to the chat room. So if my colleagues can be prepared to sort of unmute as necessary, that would be a great help. Comment here, and it's something you said, is sometimes we have to take a media break as well. Turn off the TV, stay away from the social media, turn it off, refresh, and come back later.
Right. Right. It's such a great point. And you know how it makes you feel if you're self-aware. And anybody who is a business owner needs to be self-aware in order to continue, in order to stay well, in order to be a good leader, in order to be a smart business person. You have to be self-aware. And that is part of it, is knowing that I'm really agitated. What is that? Yeah, I've been listening to this news channel all day and it's just repeating the same things and it's getting on my nerves. Yeah.
Thank you. So Waleed has had a question almost since the beginning here. I'm going to ask, yeah, you're about to be unmuted. Waleed, I'll ask you to ask your question, and then we might have time for one more question after that if somebody wants to raise their hand. Waleed, please go ahead.
Well, my question is that if the employee facing a problem out of the work environment, and maybe it is related to something you are not able to have, like financial situation. So the stress is coming from certain things that you cannot handle it. How do you get around this problem?
And so this is really a general question, is that as a leader, you can help them find resources to supplement their income, to get to food banks, to do whatever is possible in your community to reach out for help. So you can do a little bit of work and give them the resources, but then you say, here's the resources. Now, how can I help you that when you come to work, that you can feel good about what you're doing and go home with some energy at the end of the day? Because it's not your job to be a therapist. It's your job to be a leader, to help them to be well at work while they're there. But the other part that is great is to show them those resources. On our website, again, in the employee resources are different ways that you can go and look in your community and see what's available. in terms of financial help. And there's a lot. I mean, food banks, people think, well, that's a last resort. But if you can get your groceries from the food bank, then you can pay your rent. And so you don't have to be homeless or destitute. It can just be offsetting other costs.
Well, the thing is that I placed the financial example. Well, the problem could be different type of problems, like social connections, like the person having a dispute with members of his family for
Right.
some reason. So
Right.
how
And
can
so
you?
my advice is the same, to look for resources that could help them. We have ideas for resolving conflict. So it's written to the individual about how you can better resolve issues with your family, with your friends, with your coworkers. So look for the resources that can help them. And then again, go back to, but I want to help you to be able to focus on this at work, even though you have those other problems. I want work to be a sanctuary, a refuge, where you focus on doing what you know how to do so that you can feel good about yourself, and that raises your energy to go home and deal with whatever else.
I have a personal experience in that regard. When I'm stressed, I do exercise, and that give me a big relief and change in the mood, change in the thinking, change in everything. So that might be helpful as well, I guess.
Mm-hmm.
It might. For other people, especially people who struggle with depression, exercise is not an option when you're clinically depressed. You just don't have the energy to do it. But there's so many different other ideas, right? And so as a leader, you want to say, this is one thing. What do you find has worked for you? What would you like to do more of that would work for you? So it's great to share our ideas, as long as it doesn't come across that if you did this, you wouldn't be dealing with your problem. Yeah.
Thank you very much for all of this. There's so many little nuggets, Mariana, to know where to wrap up. But what I would like to do is thank you. This has been incredibly helpful. And even, I think there was a time that we wouldn't even be having this discussion, and for you to have it so resourceful and so personal, I thank you. I thank everybody who was on the line today for taking the time. And I will also take this opportunity once again to thank Canada Life and all sponsors. With that, I'll say good afternoon to everyone. I'm going to be focusing my afternoon on being the hero of my own story. So thank you very much. And everyone, please take care and stay safe.
Thank you. Bye.